Since the emergence of COVID-19, there have been many questions about how the virus that causes the disease spreads. Knowing how the virus is transmitted lets us understand how to take the best precautions to prevent workplace infection. We know people with symptoms can pass on the virus if proper precautions are lacking. But what about people without symptoms? Can they unknowingly spread the disease? Hello, my name is Carrie Cusack. I'm a training service representative with the Workers' Health and Safety Centre. As Ontario's designated health and safety training organization, we deliver a wide range of classroom and now virtual classroom training courses to assist in protecting workers' health by making the workplace safer. This webinar is one in a series we've developed to help you stay safe throughout the pandemic. If you want to download this or any of our COVID-19 presentations, please go to our website at whsc.on.ca. A video of this and all our webinars will be posted on our YouTube channel, WHSC Training. This PowerPoint will be posted on our website. You'll get a follow-up email tomorrow morning giving you the exact link. Today, we'll talk about asymptomatic transmission of the virus that causes COVID-19. I'm going to provide the most current information on whether people with no symptoms can spread the disease. We'll review highlights of the public health guidance on testing and clearance, worker rights, employer duty, and what we can do in the workplace to prevent infection. But first, let's review some basic facts about COVID-19 and what we know about how it spreads. COVID-19 is short for coronavirus disease, which emerged in 2019. SARS-CoV-2 is the virus that causes COVID-19. SARS-CoV-2 is short for Severe Acute Respiratory Syndrome Coronavirus 2. It is estimated that one person with COVID-19 can infect an average of 2.2 others. By comparison, a person with influenza can infect 1.3 others. Certain factors increase the risk of passing on the virus in the workplace. These include indoor activities, cold workplace temperature, noise requiring workers to shout, and strenuous, heavy work that causes heavy, deep, or rapid breathing. The virus is primarily transmitted by respiratory droplets and contact. Droplets are produced when an infected person coughs or sneezes. Most droplets are large and fall to the ground or other surfaces. It is also transmitted by aerosol and small droplets generated during certain medical procedures. Small droplets may stay suspended in the air for a period of time. They can infect if the virus directly contacts the eyes, nose, or mouth of another person before settling onto a surface. The virus is also transmitted by contact with a contaminated surface. Once respiratory droplets fall to the surface, they can remain active for several hours to several days depending on the surface. Workers can be infected if they touch their eyes, nose, or mouth after contact with a contaminated surface. Respiratory droplets and contact transmission are thought to be the most important routes of transmission, but they do not fully account for the occurrence of all COVID-19 cases, according to the World Health Organization. What we want to talk about today is asymptomatic transmission. That is, transmission of the virus from a person who shows no symptoms, a person who doesn't appear to be sick. But let's quickly review the usual symptoms of the disease, because as you'll see, the symptoms are important to this question of asymptomatic transmission. Common symptoms of COVID-19 are fever, dry cough, and tiredness. In some people, the virus causes more severe symptoms like high fever, severe cough, and shortness of breath. which often indicates pneumonia. Less common symptoms include aches and pains, nasal congestion, headache, sore throat, diarrhea, loss of taste or smell, skin rash, or discoloration of fingers and toes. People with COVID-19 are also experiencing neurological symptoms and gastrointestinal symptoms, or both. These may occur with or without respiratory symptoms. For example, the virus affects brain function in some people. Symptoms include loss of smell, inability to taste, muscle weakness, tingling or numbness in the hands and feet, dizziness, confusion, delirium, seizures, and stroke. Some people have gastrointestinal symptoms, such as loss of appetite, nausea, vomiting, diarrhea, and abdominal pain. These symptoms might start before other symptoms such as fever, body ache, and cough. Symptoms may begin gradually. Many people experience only mild symptoms, especially in the early stages, but symptoms can worsen rapidly, requiring hospitalization. It is possible to catch the virus from someone who has just a mild cough and does not feel sick. The time between exposure to the virus and when symptoms appear is called the incubation period. Based on current studies, the U.S. Centers for Disease Control and Prevention estimates that incubation period ranges from 2 to 14 days. Symptoms usually show up 5 or 6 days after a person becomes infected, but they can take up to 14 days to appear. This is why quarantine is recommended for 14 days. The time during which an infected person can transmit the virus to another person is called the period of communicability. Currently, the length of this period is unclear. The Ontario Ministry of Health provides 2 approaches to clearing infected cases in its COVID-19 Quick Reference Public Health Guidance on Testing and Clearance of June 25th. People have more virus in their bodies at or around the time they develop symptoms. In fact, some evidence suggests that people may be most infectious in the days before becoming symptomatic. That is, in the pre-symptomatic phase, when they feel well, have no symptoms, but they may be shedding substantial amounts of virus. What do I mean by shedding virus? Shedding is when a virus replicates inside the body and is released into the environment, through coughing, for example. Studies that have collected repeated samples from confirmed patients suggest that shedding of the virus is highest in the upper respiratory tract, nose and throat, early on in the course of this disease. Dr. Mike Ryan of the World Health Organization says, because the COVID virus lodges in the upper respiratory tract, it is easier to transmit by droplets than related viruses such as SARS, which are in the lower tract. That means you could be in a restaurant feeling perfectly well and start to get a fever. You feel okay. You didn't think to stay home, but that's the moment at which your viral load could be actually quite high. And it's because the disease can spread at that moment that it is so contagious. That's why it spreads around the world in such an uncontained way. It's hard to stop this virus, he said. Some people have no symptoms at the time when they test positive for the virus. These people may be pre-symptomatic, which means they have not yet developed symptoms. But some studies have found that some infected people remain asymptomatic. This means the virus is detected, but symptoms never develop. Some studies found a substantial number of COVID-19 patients remained asymptomatic at the end of their isolation period, never developing symptoms. The American Center for Disease Control and Prevention estimated that 35% of cases are asymptomatic based on data collected before the end of April. Can people without symptoms spread the virus? Definitely, yes. It is documented that people without symptoms can transmit the virus that causes COVID-19. But now we get into some issues about asymptomatic and pre-symptomatic. It is not yet known how often infection is caused by someone who always remains asymptomatic. Estimates are mixed. Health Canada says, according to current data, the majority of virus spread is from people with symptoms, but it's possible that people infected with COVID-19 may be communicable before showing significant symptoms. While there is good data showing that pre-symptomatic people transmit the virus, there is less information about asymptomatic people, according to Isaac Bogosh, an infectious disease specialist at the University of Toronto. Some studies estimate that people without symptoms, whether pre-symptomatic or asymptomatic, could be responsible for approximately half the spread. Others suggest lower numbers. Now, if this technical distinction between asymptomatic and pre-symptomatic seems like hair splitting, in some ways it is for our purposes in occupational health and safety. Our concern is about spread at the workplace by infected workers who don't feel sick. And it is clear that people without symptoms are a big part of the spreading. But as we'll see, this scientific debate has caused some confusion. You might remember that on June 8th, the World Health Organization's technical lead on the pandemic caused a stir when she suggested at a press briefing that asymptomatic spread is very rare. Remember, to her, asymptomatic doesn't include pre-symptomatic. Some politicians and social media commentators who didn't want to make this distinction seized on the statement as evidence that certain public health measures are not necessary. Reaction from researchers and the medical community around the world was swift, with many refuting the assertion, suggesting it created confusion. The next day, the World Health Organization clarified that actual rates of asymptomatic transmission are not yet known and cited limitations on some of the studies on asymptomatic spread. To you and me, the WHO saying asymptomatic spread is very rare might sound like it means it's very rare to get the virus from a person in the workplace without symptoms. But of course, an infected person in the workplace without symptoms could be pre-symptomatic or asymptomatic. Our knowledge about asymptomatic transmission of the virus is still evolving, but studying it is a challenge. For example, some people who didn't have symptoms at the time tested weren't followed up to see if they later developed them. So it is possible that people who were thought to have no symptoms might have developed symptoms after researchers stopped tracking them. As the pandemic has progressed, our knowledge of symptoms has expanded. Earlier research may have asked questions about common symptoms only, missing less common ones. Also, studies with few participants may also have skewed the results. These issues mean the research on asymptomatic and pre-symptomatic transmission begins to be less clear. Now, with many viral diseases, it's the symptoms, like coughing or sneezing, that cause people to expel respiratory droplets that infect others. The disease causes the symptoms. The symptoms spread the disease. So how are people without symptoms causing so much spread if they are not coughing or sneezing? It may come back to this issue of viral shedding, something that seems to be most intense before symptoms occur. Some experts suggest people who are shedding the virus but not coughing or sneezing expel infectious droplets through singing, yelling, panting, or even close or loud talking. You may have read, for example, about outbreaks from karaoke nights and singing at church. There was one terrible case in Oregon where, in a church that broke lockdown orders, 356 people in the congregation were tested, finding 236 infected. But this theory also has implications for the workplace. In noisy workplaces, people shout or yell to be heard. In work that requires a lot of lifting, pushing, and pulling, people may pant. These might be helping the virus spread. Perhaps in most cases, people get tested for the virus causing COVID-19 because they aren't feeling well. They have symptoms, but people also get tested because of a workplace outbreak around them. And people who test positive may have no symptoms. They might be asymptomatic or pre-symptomatic. This has led to a debate about whether these people who are infected but not sick can continue to work. On June 25th, the Ministry of Health published a quick reference public health guidance on testing and clearance. The document provides information on how COVID-19 can be diagnosed for people with and without symptoms. It provides criteria for when to discharge someone with probable or confirmed COVID-19 from isolation. It also explains when cases can be considered resolved. According to the Ministry of Health, healthcare employers can require non-symptomatic healthcare workers awaiting test results to continue to work, but they must ensure appropriate precautions. In exceptional circumstances where clinical care would be severely compromised without additional staffing, a return to work before the usual 14 days can be required, but they must work in so-called work self-isolation. Work self-isolation means maintaining complete self-isolation measures outside of work for 14 days from symptoms onset to avoid transmitting to family members or others. It means while at work, the healthcare worker should adhere to universal masking recommendations, maintain physical distancing except when providing direct care, and performing meticulous hand hygiene. The guidance document also explains when work isolation measures can be considered in non-healthcare settings, depending on symptoms, test results, and other factors. Work self-isolation may not be used for workers with COVID-19 symptoms. According to the document, work self-isolation should be used only for non-symptomatic workers who are deemed critical to operations. It should not replace other work accommodations like working from home, if those options are feasible. Work self-isolation can only be used when it is possible to maintain physical distancing and apply source control measures. It is at the discretion of the local public health unit. In situations where work self-isolation is permitted, the employer has a responsibility to ensure other workers are not at risk from the worker who is self-isolating at work. The work self-isolation provision have prompted concerns among healthcare professionals and worker advocates. For example, Suzanne, a nursing professor and coordinator of the Migrant Worker Health Expert Working Group, said assuming that asymptomatic workers would not spread the virus was wishful thinking. Farm workers often do hard physical labor for long hours. They are pushing their bodies to the limit, she said. If a person is actually not asymptomatic but pre-symptomatic, we could be putting that person at greater risk. The only way to know for sure whether a person has COVID-19 is through a laboratory test. Ontario has a number of assessment centres that administer tests free of charge. Ontario also has a self-assessment tool that people can use first if they think they may have the virus. The tool recommends further steps once someone has completed it. It suggests contacting a healthcare provider or the local public health unit with medical questions. Remember, if an employer is advised a worker has tested positive for COVID-19 due to workplace exposure, or that a claim has been filed with the Workplace Safety and Insurance Board, the employer must notify the Ministry of Labour in writing within 4 days and the Joint Health and Safety Committee or Health and Safety representative and a trade union if applicable. The Ministry of Labour investigates notifications to determine if the employer is in compliance with the Occupational Health and Safety Act and that appropriate measures have been taken to prevent further illness. Let's also remember most workers in Ontario have 3 important rights. This includes those who may be confronted with COVID-19. The 3 rights are the right to know about the hazards in their workplace, the right to participate in health and safety matters through joint health and safety committees and health and safety representatives, to refuse unsafe work following the procedures of the Occupational Health and Safety Act. Keep in mind, certain workers may not refuse in particular situations. For example, if it would directly endanger the health and safety of another person. These workers are police officers, firefighters, and certain healthcare workers. Teachers must ensure students are safe before enacting a work refusal. Also, farm field workers who've suffered from a large outbreak recently don't have a right to participate. And because their operations are excluded from WHMIS regulations, their right to know is also limited. Key employer duties include ensuring that the equipment, materials, and protective devices are provided and maintained in good condition, providing information, instruction, and supervision to a worker to protect them, appointing competent supervisors, taking every precaution reasonable in the circumstances to protect workers. This is a time when rights and duties are extremely important. The uncertainty about coronavirus transmission underlines the need for a precautionary approach to workplace health and safety. The precautionary principle states that reasonable efforts to reduce risk need not await scientific proof. Workplaces need a strong COVID-19 plan that includes precautions such as isolation, distance, hygiene, personal protective equipment, and cleaning and disinfecting the workplace. All precautions need to be communicated to the workers and backed up by training where required. Workplaces also need an active joint health and safety committee or representative supported by the employer. The Workers' Health and Safety Center's COVID-19 training module has more details. In addition to this series of webinars on COVID-19, the Workers' Health and Safety Center is now offering virtual classroom training. We've modified a number of our most popular programs so they can be delivered via a virtual classroom, including certification training for Joint Committee members. Recently, we added a course on the hazards posed by the virus that causes COVID-19. You can register for our virtual classroom training on our website or by contacting one of our training service representatives. If you want to download a copy of this presentation, you can get it from our website. And if you want to watch this webinar again, or send it to someone, by tomorrow you can find it on our YouTube channel, WHSC Training. You'll receive a follow-up email tomorrow morning with the exact links. You can also follow the latest developments via Facebook or Twitter. Let us know how we did today by completing the poll posted on your screen. Let's now take some questions. Okay, here's one. I work at a service kiosk and see many people every day, and I worry that someone might be infected and not even know it. What precautions should our workplace take? Yes, working with other people and the general public is a real challenge. Again, people without symptoms don't feel sick, so why would they think they shouldn't come to your kiosk? So the precautions are the full range of recommended by public health officials: distancing, regular cleaning and disinfecting, hand hygiene, masks for staff, increased ventilation, and remember, your employer can require customers or clients to wear masks in your workplace. Let's see. Okay, here's another one. Our Joint Health and Safety Committee is being told that because the likelihood of someone being infected is low right now, we don't need masks when we can't distance. Do you agree? Absolutely no. Workplace shutdowns were all about stopping social interactions as immediate precautions from the pandemic wave, and to give us time to develop other strategies based on what we learned about the virus. Now, as people go back to work, social interactions increasing again, which will fuel a resurgence unless we apply the strategies we've discovered, like masks. But again, a caution, masks are not the whole solution. Isolation, distancing, cleaning and disinfecting, ventilation, using the range of measures is what is going to help protect us at work, and if we don't use them, we're heading right back to a lockdown and closures, which means people losing their jobs and incomes. Okay, I've got time for one more. Let's see. Okay. When the WHO person said it was very unlikely to get the virus from an asymptomatic person, did she just mean a person without symptoms? No, and that's where the confusion comes in between what you and I might think asymptomatic means and how a research scientist uses the word. If you don't have symptoms today, but you are infected, you might be asymptomatic, be the medical research definition. You never develop symptoms. Or you might just be pre-symptomatic. In our everyday layperson reality, it's probably clearer to talk about symptomatic and non-symptomatic, since we can't go into the future. Okay, well, that's all I have time for. All of the questions that you've submitted will be answered. We will be answering all questions with our training service representatives. And if you have any questions moving forward, please feel free to contact our offices, and the number is on the last slide. Thank you very much for joining, and please stay safe.